Ever wondered what HIV is and how it affects the human body? Well, you're in the right place. Today we're tackling the first part of a crucial and often misunderstood topic. HIV Unveiled, What You Need to Know. Welcome to the Victory Education Lounge. I'm your host Maurice, and today we're diving into a crucial topic, HIV Unveiled, What You Need to Know, Part 01. Before we begin, please take a moment to like this video, subscribe to our channel, and share your thoughts or experiences in the comments below. Your engagement helps us create more informative content and foster a supportive community. Now let's address an important disclaimer. The information in this video is for entertainment and educational purposes only. Any health-related decisions should be discussed with a licensed physician. HIV, or human immunodeficiency virus, is a global health concern that has had a significant impact on millions of lives. This virus is infamous for its assault on the body's immune system, specifically targeting the CD4 cells. These cells play a pivotal role in our body's defense mechanism, helping us ward off infections. When HIV enters our system, it begins to compromise these CD4 cells, hampering our body's ability to fight off diseases and infections effectively. Over time, without proper treatment, this can lead to AIDS or acquired immunodeficiency syndrome. AIDS is the final stage of the HIV infection where our immune system is so severely damaged that it struggles to combat even the most common diseases. Now, here's the thing. HIV doesn't transform into AIDS overnight. It's a gradual progression that can take years, even decades. And during this time, it's possible to manage the virus and lead a healthy life with the right treatment and care. But what does managing the virus entail? How do we prevent the spread of HIV? What are the implications of living with this virus? To answer these questions, we need to delve into the nitty-gritty of HIV. Let's delve into 5 key aspects of HIV that everyone should know. Let's get started with the 5 key aspects of HIV. First up is transmission. HIV is mainly transmitted through bodily fluids such as blood, semen, vaginal fluids, and breast milk. However, it's crucial to understand that HIV cannot be passed on through casual contact like hugging, shaking hands, or sharing utensils. Secondly, let's talk about testing. Early detection is a game changer when it comes to managing HIV. Tests are widely available and can detect the virus as early as 2 to 3 weeks after exposure. Next, we have treatment. While there's no cure, antiretroviral therapy or ART can effectively manage the virus, enabling those with HIV to live long, healthy lives. The fourth aspect is prevention. There are several methods such as using condoms, pre-exposure prophylaxis known as PrEP, and post-exposure prophylaxis or PEE that have revolutionized HIV prevention. Lastly, we need to address the stigma. Despite the medical advancements, there's still a significant stigma associated with HIV, which often prevents people from seeking testing and treatment. Now that we have an understanding of these aspects, let's examine some solutions and strategies for managing and preventing HIV. It's time to explore some of the solutions and strategies for managing and preventing HIV. Let's begin with antiretroviral therapy, commonly known as ART. This is the cornerstone of HIV treatment and involves taking a combination of medicines daily. On the plus side, ART can suppress the viral load to undetectable levels, enabling people with HIV to lead a near-normal life expectancy. It also significantly reduces the risk of transmission. However, it does require strict adherence to the medication regimen. There can also be potential side effects, and it's important to remember that it's a lifelong treatment. Next on our list is pre-exposure prophylaxis, or PrEP. This is a preventive strategy where people who are at high risk of contracting HIV take a daily pill to lower their chances of getting the virus. The pros of PrEP are that it's highly effective in preventing HIV infection and empowers individuals to take control of their sexual health. On the other hand, it requires daily medication, and while it's a useful tool in the fight against HIV, it doesn't offer protection against other sexually transmitted infections. Like any medication, there can be potential side effects. Remember, these strategies are not mutually exclusive. They can and should be used in combination based on individual circumstances and under the guidance of a healthcare provider. It's also worth noting that these strategies are complemented by others, such as consistent condom use and regular testing, which we'll discuss later. The key takeaway here is that while HIV remains a significant global health issue, we have effective tools to manage and prevent it. It's all about early detection, regular treatment, and taking preventive measures. In the next scene, We'll continue discussing more strategies. Stay tuned and remember to consult with a healthcare professional for personalized advice. Let's continue with our discussion on HIV management and prevention strategies. First up, let's delve into post-exposure prophylaxis, or PEP. This is a short-term treatment started after potential exposure to HIV, ideally within 72 hours. The advantages of PEP are that it can prevent HIV infection if taken promptly, and it can offer peace of mind after a potential exposure. However, the cons include the need for swift action after exposure, a 28-day course of medication, and potential side effects. Next, we discuss condom use. Condoms are an effective method of preventing HIV and other sexually transmitted infections. They are inexpensive and widely available, making them an accessible choice for many. The downside, however, is that they require consistent and correct use. Some people also report a reduced sensation when using condoms. Lastly, let's consider regular testing. Early detection of HIV allows for prompt treatment, and knowing your status can help prevent transmission. Regular testing, however, can bring about anxiety and requires regular medical visits, which not everyone may be comfortable with or able to manage. It's crucial to remember that these strategies are not mutually exclusive. Using them in combination can offer maximum effectiveness. For example, using condoms while also having regular tests can greatly reduce the risk of transmission and ensure early detection. Also, it's important to note that the best approach can vary from person to person based on their individual circumstances, lifestyle, and overall health. Therefore, always consult with a healthcare provider to determine the best approach for you. Remember, using these strategies in combination can offer maximum effectiveness. Always consult with a healthcare provider to determine the best approach for you. Now let's debunk some common misconceptions about HIV. First off, a common myth is that HIV and AIDS are the same thing. In reality, HIV is the virus that can lead to the development of AIDS. AIDS is a condition that arises when the immune system is severely damaged by HIV. Next, the misconception that HIV can be transmitted through casual contact, like touching, hugging, or sharing utensils. This is not true. HIV is primarily transmitted through direct contact with certain bodily fluids of an infected person, such as blood, semen, vaginal fluids, and breast milk. Another widespread myth is that only certain groups of people can get HIV. The fact is, HIV doesn't discriminate. Anyone, regardless of age, gender, race, or sexual orientation, can contract HIV. The next misconception we'll address is the belief that you can tell if someone has HIV by how they look. This is absolutely false. HIV often has no visible symptoms, which is why testing is so important. A dangerous belief is that if both partners are HIV positive, there's no need for protection during sex. This is incorrect. Reinfection or superinfection can occur, where a person with HIV gets infected with a different strain of the virus. This can lead to more severe health issues and complications. Another myth is that HIV is a death sentence. With modern medicine, this is far from the truth. Antiretroviral therapy can control the virus and prevent its progression to AIDS, allowing individuals to live a near-normal lifespan. Finally, some people believe that you can't get HIV if you're on birth control. While birth control methods may prevent pregnancy, they do not protect against HIV or other sexually transmitted infections. As we conclude this first part of our HIV series, remember that knowledge is power. Understanding HIV, its transmission, prevention, and management is crucial for everyone, not just those directly affected by the virus. In our next video, we'll delve deeper into the latest research, treatment advancements, and the global effort to end the HIV epidemic. We'll also discuss the importance of creating a supportive environment for those living with HIV and how we can all contribute to reducing stigma. Thank you for joining me in the Victory Education Lounge. If you found this information valuable, please give this video a thumbs up and share it with others who might benefit. Don't forget to subscribe for more health and wellness insights. Remember, staying informed and breaking down stigma are key steps in the fight against HIV. Until next time, this is Maurice wishing you health, happiness, and victory in all your endeavors. See you in part 02.